Well, good morning. It is now 8 o'clock. Time to get started. Welcome to the 2018 Consensus Conference, and welcome to Indianapolis, my home city. I might throw in that I'm Jeff Kline, the Editor-in-Chief of Academic Emergency Medicine, and we will publish the proceedings of this work. A couple of deadlines. July 15th is our deadline for papers related to the proceedings, and August 15th, final deadline for science. So far we have 8 papers submitted, which I would consider to be very good so far in terms of numbers. And speaking of numbers, let me give you some other numbers from our journal. I took over fully in terms of handling all of the papers in December 1st or so, 2015. Since then, we've had a total of 2,454 submissions to the journal. 300 exactly were categorized as pediatrics. Now, out of those, 1,787 were original contributions, real science, original data, and 254 of those were pediatrics, or 14% of the total. So that's pretty good. I mean, if you think about the fraction of patients that are children in the average community emergency department, it's somewhat representative. Now, out of that 250, 31% were sent for review. Now, that number is a little bit lower than the average, maybe by about 10%. So there's a little bit of an issue there in terms of us getting papers that are retrospective single-center studies that are really descriptive. So there's some work to do there, just telling the truth. This consensus conference will help generate ideas that overcome the idea of going to M&M and finding the next topic. As we sit here, I think about 25 years of practice and the major things in my own life that changed how I functioned as a doctor. And the single biggest one was becoming a parent and having children, and then being able to walk into the room and actually have an empathic conversation with parents. I think the hardest part of pediatrics. And really understanding this concept of the needle in the haystack. And also patient-centered care. And that's one of the reasons that, as editor-in-chief, I picked a particular paper about ultrasound-guided lumbar punctures. Now, if any of you are the authors on the paper, it was an okay paper. It was still very preliminary, and I really had to actually fight to get this randomized trial accepted. But the reason I wanted it accepted was actually purely, I'm not gonna lie, it was an emotional reaction, remembering what it was like when I was a parent and had a baby. And if my little girl got a fever, the last thing I wanted to do was bring her to the emergency department, because what was going to happen? If she got near an intern, she was going to get a lumbar puncture, and I was afraid of it. And I thought about that as editor-in-chief, that this is a paradigm-shifting concept. Now, it wasn't the first paper to do this, and it wasn't probably ultimately going to be the best paper, but it was concept-shifting and idea-shifting. And that's part of what we're going to do here at this conference, is challenge the dogma, using the NIH terminology for innovation to go after new ideas. Things have really changed in 25 years. I remember doing lumbar punctures in the pelvic room on infants, sort of semi-supervised. And I remember when I was a resident taking care of a child that took three SR verapamils and became hypotensive, bradycardic, and there was just nothing we could do for it. And sitting at the bedside and saying, I want to do something for this. And that's one of the reasons I personally got into research and ended up studying insulin as a treatment for verapamil. That's how I got started, was in the laboratory, thinking about that single child and the fact that I never wanted to sit there and be helpless again. That there's a wide opportunity for new research, and I think that you really can't appreciate how much things have changed until you understand the PCARN initiative that Dr. Kuppermann will talk about, and how powerful that particular entity has been in terms of moving the research agenda in pediatrics. Because until then, there was really no network or no way that we all aligned our thoughts. Now, this particular conference was and to some extent the brainchild of Jen Walthall, who can't be here with us now because she's busy taking care of like about a $900 billion initiative here in the state. But she sends her best wishes, and she will be here at the conference, and in particular will be here tomorrow morning when during the awards ceremony. So thanks to Jen Walthall for the initial idea. So we have a pretty packed agenda today, and I was only going to take a few minutes to get things started. And I'm going to turn things over to the real leaders of this program, and I'm going to take a back seat after this. And I'd like to introduce Paula Ishimine.